Good morning, everyone, and welcome to Whitmix's webinar, Who Says the Masseter Doesn't Count? The Importance of Screening with EMG. My name is Craig Pickett, and I'm the Manager of Technical Education for Whitmix, and I'll be facilitating today's webinar. I'd like to begin with a few housekeeping items. First of all, in the upper right-hand corner of your screen, you should see a questions box. Please feel free to type in any questions you may have throughout the presentation. Charlie will be answering your questions at the end of the webinar, or if we don't have an immediate answer for you, we'll certainly endeavor to get a hold of you, or you may email us at bjarislow@whitmix.com. Next, if you're a CDT, this webinar is approved for 1 hour of CE credit toward your certification, and you'll receive an email within 1 to 2 days that will tell you how to obtain your credits. Also, you should know that the webinar is being recorded, and within 48 hours it will be up on the Whitmix website in the webinar section. If you're another dental professional and will require a certificate to turn into your granting board, we just need to have that information, and you can respond to us with the email that comes to you as a participant. This morning, I have the pleasure of introducing Shirlene Charlie Oressa. Charlie began her career in dentistry as a dental assistant and then as a dental hygienist. And after practicing dental hygiene for 18 years, Charlie started her own business by hosting dental education seminars while working as a public relations representative for Delta Dental of Illinois. Ms. Oressa obtained a degree in communications with a minor in marketing from Bradley University in 2000. And then after graduating, she started in a sales and marketing position with Dental Arts Laboratory in Illinois. Charlie joined the occlusion division of Waterpik in 2007, where she became the territory sales manager for the western region of the U.S. Charlie serves as Whitmix's resident expert on sleep dentistry in medicine. She is currently responsible for dental schools located in 22 states. Whitmix acquired Charlie when we acquired the Hanau and Danar products from Teledyne. Charlie currently lives in Peoria, Illinois, and that's it. So Charlie, if you're ready, let's talk about screening with EMG.
Thank you, Craig. That was a very glowing introduction. It's really windy here in Peoria, Illinois, but it's a great day to be working. And this is my first webinar, and I'm really excited about doing it. And we've got this riveting subject of measuring the masseter muscle. And you're probably wondering why Whitmix is getting into the sleep business, dental sleep medicine business. And as Craig said, Whitmix has been in the occlusion business for at least 99 years. And in February of 2008, they acquired the Danar Hanau line of articulators and laboratory equipment. That gave them even more traction in the occlusion product line, and because occlusion is the main part of the business, and bruxism is the dental aspect of dental occlusion, a dental aspect, then we decided that measuring that bruxing symptom would be important for our product line as well. So again, reinforcing our company motto, one source for everything. So we are attempting to address this situation as well. Because the impact of sleep medicine to dentistry is new. And as you can see, there are many dental seminars now at every trade show, and there's plenty of dental meetings out there. There's even trade shows that are specific to dental sleep medicine. I traveled to dental schools in 26 states, and I'm seeing the dental schools changing the curriculum and adopting dental sleep medicine as part of their curriculum. And many of the schools have already gotten on board with having a clinic within their school where they're monitoring patients on a regular basis because of its strong connection to dentistry. And I've been a hygienist for a number of years, and this is very new to me because I don't ever remember having the course in teaching anyone or examining anyone for sleep bruxism or any sleep-related disorders because we were a dentist. We have a very distinguished key opinion leader, Dr. Ken Burley, and he is an attorney and a dentist, And he did a seminar for us not too long ago. In fact, he did 2 of them, and they are also on our website. You can go to our resources area and pull up A House Divided, which is a legal issues that he put together for us. And then another one is on implementation. 2 really good webinars you should see. But one of the things that I took away from the seminars was that you got to remember to practice sleep medicine according to the Dental Practice Act in your state, because they govern how you treat airway issues. And then he also further comments on the importance by saying that the oral cavity is the entryway to many airway issues, and therefore we cannot, as dentists, ignore addressing sleep-related disorders. So that's why we're here today. And measuring the masseter muscle, which is a tongue twister, is going to be a big part of monitoring and taking care of patients with sleep apnea. Obstructive sleep apnea has been associated with many disorders such as heart disease, respiratory disease, systemic disorders, and in children, if it's not treated and it goes along undiagnosed, obstructive sleep apnea can be associated with cardiovascular problems in children and impaired growth. So it can also, I've heard, cause behavioral problems and learning disabilities. And you know, if a child goes to school sleepy and hungry, they're not going to perform well. So we can help address those sleepy issues. Plus, statistics say that 1 in 5 Americans now are affected with some sort of sleeping disorder. So there's a lot of business out there for us to do, and we need to start tackling that to the best of our ability. Our objectives today are to identify reasons to utilize a home sleep monitor and to understand why we measure the masseter muscle activity, and to review the data from the muscle masseter movement monitors that I'm going to show you. Since sleep apnea is a potentially life-threatening medical condition, like I said, it often leads to cardiac problems, diabetes, and weight gain. That's a test question, by the way. We need to work as a team with the medical community to get the patients the help that they need. And so we got to measure the patient's nighttime sleep habits, specifically the bruxing and oxygen desaturations. The dental profession has to address the parameters surrounding the measurement of the masseter muscle activity because it has an effect on occlusion. So your long-term restorations are going to be greatly affected by the intensity and frequency of which they brux. Monitor with an EMG sensor is the only way you're going to get that frequency and intensity of measuring the masseter muscle and how it might affect your long-term restorations. So we're going to also mention a couple pitfalls about the PSG testing where patients go to the hospital. And we're going to show you a little bit about the interpretation of the testing that you're going to do with the home sleep monitors. It's very simple, and I just want to introduce you to it. Not trying to sell you on it, but I want you to know the key differences. Why does a general dentist need a home monitor? Very simple. Placing any kind of appliance in a patient's mouth. You know, whenever you put an appliance in a patient's mouth, how do you know it's effective? I mean, if you're putting it there as a bruxing appliance, of course you can see the wear on an appliance. Plus, if that wears it down so low, how long is it before it's ineffective? Also, it helps you determine the source of pain. A patient complains of neck pain, jaw pain, headaches. Whether it's either one of those, how can you differentiate when the pain is radiating throughout the whole right side of their face or left side of their face? If you have an EMG lead and specifically put it on that masseter muscle, you can pick up muscle firing activities that you can only measure with an EMG lead. Plus, you can be screening for sleep or breathing disorders and titrating appliances. So if you're going to be screening somebody for a breathing disorder, a sleep breathing disorder, you're going to do that because they've already told you, I'm so tired. I'm tired all the time. Those are little things that you can be picking up on to trigger whether or not you should be measuring the patient at all, with or without a bruxing appliance. But because we're dentists, we should always be including the masseter muscle measurement. And if you're titrating an appliance, like I said, those appliances wear. How can you, validate that it's still doing what it's supposed to be doing? And if you're titrating an appliance for the first time, you can really have an opportunity to titrate the appliance by seeing what the oxygen desaturation levels are getting and the heart rate changes are doing during that titration period, so you know whether to advance that appliance forward or backward. And you can do that with a temporary appliance as well, where you can measure a patient with a temporary appliance and then measure them without the appliance and see the difference to actually show the patient and educate them at how much it's going to help them. Also, the cost of monitoring. Monitoring with the home monitor system is so inexpensive. And just so you know, the startup cost to start monitoring is one of the lower costs that you'll have in dentistry. And the cost of a hospital PSG test, the lowest I've heard has been $3,500, and it's been as high as $6,000 depending on where you are. Plus hospital PSGs, you're not doing it in the comfort of your own home. And what if you don't have a good night's sleep that night? How effective can that one night study be? Also, now the ADA is recommending it to screen all patients for SBD, sleep breathing disorders. Sometimes acronyms are great, but sometimes it's like, what are they trying to say? So I will define those, and if you don't know what they are, please don't hesitate to interrupt me. So broken teeth and wear can be photographed. However, it doesn't give you any indication of intensity or grinding. So there's a lot of information that you can put in the patient's chart that they have bruxism and everything like that, but nothing's going to give you the intensity or frequency as an EMG lead would be. Okay, the ADA recommendations. Here's a couple highlights of that recommendation. It was done in Atlanta and the ADA meeting in 2017. And here are the highlights that I actually extracted from Dr. Burley's webinar. Dentists are the only healthcare provider with the knowledge and expertise to provide the oral appliance therapy. And it's been stated that oral appliance therapy can treat sleep apnea for mild and moderate sleep apnea. And medical community cannot make these appliances. Most all of the medical community, they'll right away, first line of defense is a CPAP. But now dentists who provide the oral appliance therapy, they should monitor their patients and adjust the appliance for treatment efficacy as needed, or at least annually. So therefore, if you have installed an appliance and you have to monitor annually, how are you doing that? Are you questioning the patient? How do they feel? Are you palpating using a questionnaire? These studies, there are studies that state that grinding is indicative of sleep apnea, which is a bit more serious than broken teeth. So you got to be sure that you're measuring effectively and making sure that you're not hindering with your appliance. So you're placing appliances all the time in a general dentistry setting. Bruxing, protection of your restorations, airway opening, snoring, TMG and facial pain, ortho and sleep apnea appliance if you have a script. All of these have the potential to help as well as to hinder. I found this study with Mayo Clinic, and Mayo Clinic says that sleep-related bruxism is considered a sleep-related movement disorder. And clenching or grinding during sleep are more likely to have sleep disorders such as sleep apnea. So with that in mind, you're going to see facial pain. And with facial pain, when we talk about facial pain, like I said, we have different diagnostic tools to help us determine what's what and where it's coming from. And for years, doctors use x-rays as a helpful in diagnosis of decay, but they don't use those as a 100% diagnostic tool. There has to be other measures, clinical measures, tools that you use between questionnaires, monitors, whatever, to incorporate and use for diagnosis of sleep bruxism. We have a really healthy relationship with the Dawson Institute, or the Dawson Academy, excuse me. And Dr. Whit Wilkerson does a wellness program. I was at his program, and he stated that they're going to be doing a lot more integration of airway disorders in their treatment planning, because so many of the facial pain symptoms that they were using as triggers for TMJ signs and symptoms, they're also the same for bruxism. Here's some of the screening tools. I pulled these off the internet. You can too. Their forms are not copyrighted on the internet anywhere, so you're not violating any copyright laws. This is a couple popular ones, the Stop Bang questionnaire and the Epworth Sleepiness Scale. If the patient scores high on these scales, then of course you would want to send them to a medical doctor or start looking for other signs and symptoms of sleep disorders, bruxing, and things like that, so that you can move this patient down the right path. Let's see. Why measure with the EMG of a masseter muscle with a home monitoring device? Well, a typical full PSG measures a portion of the jaw muscle. It's the submentalis muscle, which is underneath the mandible. And that muscle there, they're actually looking for atonia, which is a hallmark of rapid eye movement. And in the sleep world, that's very important. However, there are two major concerns with the PSG test. One is the location of where they're putting the EMG lead. It's not necessarily right on the masseter muscle. And they're a sleep community, and they can only assess and identify. They don't assess and identify TMG issues or bruxism issues. What they see is generally their view. We're the dentist, and we treat those. So bruxism is traditionally considered an oral parafunction, and it's characterized by involuntary grinding and clenching of the teeth. And the craniofacial pain centers out there and the TMD specialists, they take surface EMG measurements, and the patient's awake and sitting up. So really, how effective is that when Mayo Clinic says that the sleep disordered breathing occurs predominantly at night? So another problem with this is that they put a device between the patient's teeth to take a measurement of the bite force. And if there's something between the patient's teeth, then the teeth aren't completely occluding. So when that therapeutic device prevents full occlusion, you could get a weaker EMG signal. So if you saw signs of bruxism in your patient at first glance when they're sitting down in your chair, and you thought, okay, and he's complaining of sleepiness and he scored high on the Epworth sleepiness test or the Stop Bang method, you refer them out, but still you want to know what's going on with that masseter muscle activity and have that documented in the patient's chart, because there's definitely some wear going on here, and it's going to affect how you're going to treat this patient long term. Now let's talk a little bit about intensity and frequency. The average bite force for a patient is between 80 and 125. The measurement with the bruxism monitor, they often yield scores of microvolts up above 300. But I've been doing this measuring with the GemPro and the Knox T3 for over a year now at different trade shows and dental sleep meetings. And I'm surprised. Sometimes I get patients that are in the 1100s. I've got a patient I'll show you later with the Knox. It's really drastic with his, amount of activity during the night. And you'll know why it's important to measure. So study shows also that bite forces change dramatically during sleep, and a therapeutic device that's useful at night is not going to be necessarily the same in the daytime. There's also rhythmic masticatory muscle activity, which does not include bruxing. So you may not see any wear, but it's unique to sleep, and it still can be very damaging. Okay, I found this little guy when I Googled some jaw muscles and masseter issues and strength of jaw muscles. And his masseter muscles obviously very strong, and he can bite into anything, and he doesn't have a tooth in his head, and he can even take off a finger. So bruxism basically is our baby. It's our dental team project. We need to do this, and we need to measure to confirm all the findings from our treatment plan, and it will help quantify our analysis for referral, and it will also aid in recall when you're recalling for appliances or titrating. So if you're practicing sleep medicine, you should also be measuring for bruxism too. And the good thing about it is it doesn't cost any more to measure for bruxism, maybe 80 cents when you consider the cost of the sensors for the leads. But that's very inexpensive and easy to incorporate. And the effort is no greater either. So here's this article I found, and it's called Sleep Bruxism, a comprehensive overview for the dental clinician interested in sleep medicine. And it is based the assessment and diagnosis of sleep bruxism is often challenging because the assessment's based on tooth grinding sounds during sleep in the presence of clinical signs and symptoms. However, how do you do that if you don't see the patient at night? So sending home a home monitor is one of the logical things to do at this point, because only an EMG recording of the masseter muscles can confirm sleep bruxism diagnosis. A clinical diagnosis of sleep bruxism should be based on the international diagnostic criteria by the American Academy of Sleep Medicine. And grinding sounds are caused by tooth contacts, which is a pathogenomic sign of sleep bruxism. And they're usually reported by patients or bed partners, siblings, and parents. But like I said, with those RMMA episodes, they may not be accompanied by tooth grinding. And so with using a monitor, you can capture all of that information at once. In the same article, a clinical examination of the oral cavity, you can identify signs and symptoms that are markers of tooth grinding and clenching habit, which are hypertrophy of that masseter muscle. You can see some enlargement. And the tongue indentations of the teeth on the lateral borders. There's tooth wear, jaw muscles, tenderness, pain with palpitation, and morning headaches. However, none of these signs alone will constitute proof of sleep bruxism. One more thing, what do these symptoms sound like? Dr. Whit Wilkerson said these are some of the same that they use for the TMJ exam. Tooth wear is the classic dental sign for bruxism. However, there are other related factors that may not necessarily be bruxing that can cause tooth wear or changes in the enamel that might make you think they're bruxing. Age, of course, we all change with age and wear. And your occlusal conditions change. What if you have a diet of carbonated beverages? The sweet, acidic nature of those beverages can cause a weakening of the enamel, and maybe just normal light intensity in bruxing or putting your teeth together can cause some damage. Also, enamel characteristics. We're not all born with the same enamel makeup. So you can have some issues there with decomposing enamel, which you might confuse with bruxism. Medications, acid reflux, or other alimentary disorders like anorexia can cause erosion and destruction of the enamel, and certainly can be confused with bruxing and cause damage. Okay, before we go any further, we have identified reasons to use a home sleep monitor. And we measure the muscle, and why we measure the muscle activity. I told you that was a tongue twister. So now I'd like to focus on the data that you get from these two monitors. And these are the two monitors that Whitmix sells. And so these are the ones that I have the data to share. So just a little bit about the monitors. The Gem and the GemPro are basically used for screening, whereas the Knox T3 has a diagnostic capability. On the lower left of your screen there, you're going to see the case with the GemPro, the Gem. And the Gem is 2 channels of information, heart rate and oxygen. And the GemPro is an upgrade that does the same thing, as well as adding the body position, the sound, and the EMG leads. So with those 5 channels of information used for screening, you're going to get a really thorough opportunity to measure the patient's bruxing, hear it, and their oxygen desaturations and heart rate changes. The heart rate variability, which is a term I want you to listen for in the next short video I'm going to show you, because it's a test question. So the GemPro is really nice because the best feature is that all of that information is captured via Bluetooth onto that tablet. The tablet lays on the patient's nightstand. The next morning when the patient finishes that test, they push finish, the test results wrap up and get emailed right to the doctor. Now that is super convenient if you're titrating an appliance, because you know how much chair time you use when you sit a patient down for a few minute exam, whether it be, titrating an appliance, adjusting a denture, checking a restoration, some quick thing. You still have to go through the whole procedure of changing all the consumables out for sterilization and the labor of seating the patient, just they have patients' inconvenience of going back and forth. So this simplifies that procedure of titrating appliance so well. When you can see that study in your office the morning of, you look at that, you look at the oxygen desaturations. If they've improved and they're at a healthy level, then you tell the patient to bring the unit back in. If they have not improved, you can have the patient turn the appliance, the temporary appliance, a quarter of a turn, or change the straps, whatever mechanism you've given them for a bruxing appliance or an airway appliance or snoring appliance, and then have them bring it back to the office when they're finished. So the next one is the Knox T3. The Knox T3 is diagnostic. It goes to a little bit deeper dive in measuring the bruxing and the heart rate and the body position, and you'll see 14 different channels of information. This unit will give you the AHI, like I said, that they use, which is the magic number for diagnostics. So the next thing I want to do is really go into the data, and I want to show you a quick video of Dr. David Bennett. He created that shows how he uses this information to evaluate the GemPro information. Whoops, hold on here 1 second, get this video going here.
In this module, we will look at the data that the GemPro system provides, give you guidelines as to how to analyze it, and to walk through a few sample tests. There are 3 key pieces of data that GemPro provides. It provides you data for oxygen saturation, for heart rate analysis, and bruxism analysis while the patient sleeps. Let's take a look at how to analyze the data in these 3 different areas. So SpO2 analysis or oxygen analysis, the way that this is broken down is there are 3 lines. There's 92% oxygen saturation, 89% oxygen saturation, and 85%. And then there are percentages of the time that they are at or below these numbers. You should see someone ideally be above 92 all the time. If you see them falling below 92, but not to 89, this is the low end of normal. When you see people falling at times below 89%, the percentage of time that they should be at this level of saturation should be in the low single digits. This would give you an indication of some airflow limitation. And below 85%, this should be 0. As their time percentage at below 85% oxygen saturation increases, they are at a higher and higher risk of OSA or obstructive sleep apnea. The second piece is the heart rate analysis. What you have is their heart rate max and their heart rate minimum. If you have a high max and a very low minimum, you've got a large heart rate variability, and this is a good thing. This means that their body is trying to compensate for having difficulty breathing. If you have a low max and a high minimum, meaning a very narrow range, then this is an indication that their body is not doing a good job of being able to manage these oxygen desaturations, because oxygen desaturation normally causes heart rate to increase. And if it does not, that person's body is no longer working to fight. The more narrow the range, the more at risk the patient is. The last and perhaps most important piece of data at least as it relates to us as dentists, is the bruxism analysis. In this section, it tests multiple things. It can give you data and test the amount of force that is applied, and it gives you data on the amount of times that the person is clenching or grinding in the night. So under the magnitude section, what it does is it lets the patient do a baseline test where the patient will clench down while they're awake when they're calibrating the system to see how much force is applied. And then at night, it will also measure how much force is being applied to the teeth. And it is often the case that the force that is applied when they're sleeping is greater than what they apply when they're calibrating it when they're awake. The divergence of this and how much greater the force is that they apply when they're sleeping leads to more severity and more severe clenching, grinding, and effects of that on the teeth. The second piece of the bruxism analysis is the frequency of events. And with these frequency of events, it also tells us how strong and how severe the clench is or grind is during that time. And it will tell you how many events occur. So let's take a look at some examples of some tests so that you can have an understanding of how to look at the data.
Okay, so you're still with me? That was a quick video on how he interprets the GemPro data. And Dr. David Bennett and Dr. Galen Dietrich host online seminars with the Disruptive Dental Collective, either on Facebook, Google them, find them or else contact me after this webinar. They have some great videos and programs to help you learn how to interpret and use all this with planning your cases. The next thing I want to talk about is the Knox T3. And the Knox T3 digs a lot deeper in the frequency and the intensity of bruxing, and this software will allow you to see the bruxing episodes as well as all other sleep elements that pertain to sleep apnea that a patient will experience. And so I'm going to show you basically, here's a normal phasic episode from one of the graphs. There's a clench. You can see the intensity, the black there is increased. And they have a hypopnea right after that. And then you have the obstructive sleep apnea, which leads up to a clench. They say that clenching often opens up the airway so that the patient can breathe. So if you have an obstructive episode and then you're clenching, that will then allow the patient to breathe better. And then here's an example of basically where you have the airway relationship showing the airway triggered bruxism. Okay, so I would like to now just dip into the Knox T3 software for a moment. I'm going to escape from this PowerPoint real quick and pull up my Knox T3. And here I have a patient. When you bring the Knox T3 in, when the patient brings the Knox T3 back to the dental office the next morning, it takes about 1 minute for them to download this information into your computer. And it's done with a simple USB port connecting. And here's the banner page that you see when you open up. This is really helpful and it looks complicated, but it's very easy to interpret. And I like this because when you're first learning, you're going to be able to put the cursor over each line and determine what that is. So it tells you this is the activity, how much activity the patient's had. This patient's got a lot of activity going on and with that dark brown line. Underneath here, it shows the patient's position, left, supine, right, whatever position, body position they're in. These brown dots here are obstructions, and it tells you the location is in the rip flow, which is the cannula. And then here's another area where they have hypopneas. It's also in the rip flow where it's measured. Here's types of DSATs. This patient here has a lot of DSATs. It's very constricted. And you notice over here, these two lines went blank. So this patient took off the pulse oximeter sometime during the night. And what that does is actually produces an artifact right here. This big red line shows you that there's an artifact. whenever you see these little squares over here that are red, those are danger areas, and you want to pay attention to those. When I first looked at this study, when I open it up, if your assistant downloads this for you, she can come in and say, hey, doc, you're either going to have the green conversation, this patient's normal, or they got some mild and moderate activity going on. Their AHI falls in the mild and moderate, or else they're severe. And this patient, if an assistant looks at this and says, oh my gosh, they're severe, you might want to take a second look at that, because you look at the signal quality down here, and the signal quality of this test is only 45%. Well, the cool thing about this software is that you can cut this off, and you can slide that up here and get rid of the majority of the artifacts. Now look what the signal quality goes up to. So your test hasn't been trashed. And you can still make a really good diagnosis, because you only need 4 hours of good sleep time in order to make a diagnosis. If you put your cursor over any one of these values, it will tell you what it is and how they arrive at that. The number of sleep apnea and hypopneas or hypopnea events per hour in sleep, the minimum and maximum. Here's the ODI. Some doctors like to use that as an indicator of health. And here's the average heart rate and the minimum and the maximum, the snoring percentage. This is kind of crazy. When I looked at this snoring percentage, it says 1%. Although if you look at this says the snore trains all the way across there. What's this? This measures the ambient room noise, and it's established as a baseline. So only 1% of the time did he go above his loud baseline. So you have to just get familiar with how these tests are performed. It's really cool because you can view the signals and play audio. And I hope you can hear this, because this guy has some real issues with his snoring and his breathing. Can you hear that? Now, if the patient comes in and tells you he's tired all the time, you can pretty much guess why. Here's the pulse, 97. The oxygen level, 83. That's really low, and this is high for sleeping. I can do this on the treadmill. Okay, so let's go back to the recording and turn the sound off so I can finish showing you this. So you can see how important sounds are in recording a patient's sleep habits. And then you can also view the signals, where you can actually view them and play them. And you can move from one section of the study to another. This is a hypnogram up here of the whole night study. We cut this part of the study off. That's why it's pink. So there's artifacts there. I wouldn't want to use that. So I'd stay on this side of the hypnogram. And it shows you where the DSATs are, the duration of them. You can view all of these things in one place at one time. Also, if you happen to like to look at pie charts, this gives you a sleep time and what position they're sleeping in. And a pie chart that says they were in their supine position for 84% of the night, or their oxygen hypopneas and desaturations were 265 times during the night. So this gives you a lot of really cool information. Other things that it has is a report that you can, a respiratory report and a bruxism report. Excuse me, let's move to the bruxism report. The bruxism report right here, it says all zeros. And that's not unusual for this patient here, because he snores really loud. And because he snores so loud, he can't be bruxing because his teeth are apart. And so whenever you have a patient that's just snoring issue, I understand that that's not really snoring. It's not really a medical issue. It's not really a dental issue. So you can just treat that with an appliance. However, this guy's got a lot of other things going on, as you saw in the graph there. And this would be a perfect patient to refer to a medical. Okay, I'm closing that out. And let's go back to the PowerPoint here and conclude this with questions. One thing I want to just remind you is that the important part of using the EMG lead when measuring for bruxism and sleep apnea is that that is a big part of diagnosing sleep apnea, and it's one of the main symptoms. And it also helps you distinguish between traditional bruxism, normal bruxing, and airway triggered pair functions. And also, we need to work with the medical community, establish someone in your community to work with so that you can share this information and get your patient healthy. Sleep disorders are subtle, and measuring them early and gives you an awareness to get them taken care of. What's missing in this picture? And I hope at this point you're saying an EMG lead. Okay, here's some of the resources. And if you have any questions, you can email me or Bernie Jarslow or talk to Craig here. He will take your questions online. Oh, there.
Okay, thank you. Appreciate everything, Charlie, that you've done here. And everybody who's been in attendance today. We don't have any questions that were submitted. So once again, if you do have any questions, just submit those to Bernie Jaroslow at whipmix.com or bjaroslow at whipmix.com, and we'll make sure that we get them answered for you. Especially if you have any questions about the GemPro, or the Knox T3 unit. Either as a dentist for use or possibly even as a laboratory providing this equipment for your dentist to use. Be sure once again that you are in compliance with your state Board of Dentistry when it comes to using these kinds of devices with your patients. All right, thank you everyone. And remember that this will be recorded and up on the website shortly, and also that you will be getting an email if you've signed up for this. We appreciate you being here. Thank you.
Thank you.